be more for the minute, Secretary.
Will do.
Thank you.
Yeah.
Yep, we do.
Okay. So I declare the meeting open and welcome you all in attendance. The Audit and Risk Committee is being live streamed. There are no members of the public. Councillor Penny is in the public gallery. The Deputy Mayor is an apology, so I would just like to acknowledge that before we commence proceedings, we come together tonight on the traditional land of the Noongar people and pay our respects to elders past and present. Apologies. There is the Deputy Mayor. There's no members of the public. Does anyone have a petition? Presentation? Deputation? Does anyone have a declaration of interest to declare? No. Confirmation of minutes?
No, Chair.
Confirmation of minutes held on the 10th of June. Any additional information?
No, nothing further.
Does anyone have any questions in relation to those minutes? I'll put it to the vote. Oh, sorry, can I have someone move that way? Moved Councillor Acker, seconded Councillor Sargent. All those in favour?
Yes.
Yep.
Motion carried. And 8.1 audit reports. Do officers have any comments to start?
That's quite an overview.
Mr. Mark, please address.
Thank you. Through the Chair, this report presents the findings of 3 recently completed audits undertaken since the last meeting of the Audit and Risk.
Sorry, I'm going to stop you there. Can I just confirm that Ben and Gay can hear okay?
Yes, thank you.
Yep.
Okay.
Thank you. As I mentioned, this report presents the findings of 3 recently completed audits, 2 by Australian auditors in relation to the city's aquatic centre and 1 in relation to our essential services, focusing on the ranges, and finally 1 by RSM, that's the interim IT general controls audit. There were no high or extreme findings as a result of these audits, only low and medium findings, the majority of which were low. I'll just draw your attention to the essential services audit findings first. You may have noted an ASAP completion date throughout that report. That was because the date hadn't been determined at that time. The audit actions are now listed within the city's audit log and specified dates are listed for all those. I just thought I'd draw that to your attention in case you noticed that. Discussions are still ongoing with the City of Cockburn in relation to the possibility of shared services in this area. That's somewhat been slow due to some staffing changeovers, but we're hoping to progress that as soon as we can. In the meantime, Australian auditors will continue to be engaged when we need auditing done, and we're looking at having them undertake some further audits for presenting at future meetings. Finally, I'll just highlight that there was a 4th audit undertaken. That's going to be presented to you as part of the Work Health and Safety report.
Okay, thank you. Any questions? Councillor Sargent? Yep.
Thank you, Mayor Feasy. With 8.1 on page 16 of the agenda, just in reference to the duty officer escorting staff at dark to their cars, I just had a concern for the duty officer themselves would then be returning to the building without any, I guess, support system in place, and have we looked at that risk, please?
Through you, Your Worship, the duty officer, the team tend to leave at the same time when the building's closing, so they'll all make sure they're at their cars together. If the cars are significantly separated, one person will give the duty officer a lift to their car from the last person that's dropped off. If they're going back into the building because services or programs are still running, someone will give the duty officer a lift back to make sure they're visually seen by other staff members.
Yep. Councillor Sargent?
Thank you very much. Thank you, Mayor Feasy. Just a follow-up question on that. If the duty officer is returning to the building, would they be the last staff member present in the building. And I'm just more conscious that if they're there and locking up by themselves, like that process of a buddy system, what's the safety protocol there? Thank you.
So the duty officer will always leave with another staff member. If other programs are running, it would be, say, a netball competition where there's umpires, so they'll leave at the same time. I did forget to mention there's radios as well, so when they're in the car park, if they're entering the building again, they've got contact with the staff members in the building too, so they can constantly radio back and forward as well.
Okay. Gay, you had your hand up?
Thank you. Firstly, a question. Why in the scope was the aquatic centre excluded from this audit?
Through you, Your Worship. The aquatic was excluded because we have an annual report by LGIS, and that is consistently at a high benchmark. I think it ranges between 95 and 100% with the audit inspection. So we looked at it and thought we do have the aquatic section audited regularly through the industry, and the operational, the customer experience, health and fitness, sports don't receive the level of auditing within the industry. So we thought that there could be risks in that section that we might need to look at.
Thank you. So a follow-up question is, does that look through the insurance lens cover the same scope that this audit covered?
It's completed through Royal Life Saving, or it used to be. I might need to take this on notice. Apologies, Gay, because I'll need to make
fine.
sure it's the correct information provided.
Okay, that's fine. So I just want to make sure that we're not missing a risk by excluding it from this audit. So I'm more than happy to have that taken on notice. If I may, Chair, a follow-up comment and question. I noticed the sign-in, sign-out process was a medium risk. And our response was that we put up signs that people enter at their own risk. But I wonder if that really meets the standard of care that that are due to the patrons of Aquatic. If there was, by way of example, an emergency, under this response, we wouldn't really know whether everyone was out of the building or not. Could you provide some context and comment around that risk management strategy, please?
Through you, Your Worship. The entry point does have access control gates, so we do, if people are members entering the building, we do have their information come in with the ingress and egress of the facility. What we've also recommended, or what the auditors have recommended as part of this, is investigating tracking or digital tracking information, so where it's not identifying the person per se, but the numbers of people entering and exiting the building as a potential practical solution for managing who is coming into the facility and who is leaving, so we have a better indication of numbers in the aquatic.
So in the management comment, has that been picked up as something that we're going to do?
We're currently having a look at the CCTV that we have in the facility, because there may be capacity within the existing software, but we are aware of some software that's available as well that could be installed. So the plan is to introduce that system.
Okay, I'd really encourage us to make sure that we're at industry standard for the management of patrons who enter and exit the facility. And if I may, Chair, my final question relates to the creche. There are extremely stringent and appropriate requirements for children's collection from creches. Are we complying with all those regulations?
Through you, Your Worship. Yes, we are. It's really from the recommendation here, making sure we're documenting and checking ID. So the staff in the facility, I think there's always been in a rec centre a human awareness of who has come in the name of the parent and that relationship being a member-based facility. But now we'll be looking at how we can check ID on top of that.
Okay, and my final question relates to policies and procedures. I was concerned that the creche handbook hadn't been updated since 2019, and that was rated as a low risk. I intuitively feel that policies and procedures, if they haven't been updated for 5 years, has to be more than a low risk. So by mentioning that, I do want to say that I am pleased that that will be updated by the end of this year as a matter of, some urgency. And could I please understand what the process is for us to review our policies and ensure that all policies, not just the ones that relate to the Aquatic Centre, are updated in a timely manner? Thank you.
Through you, Mr. Med. Just in relation to that last point, Gay, so we have a process internally for the management of all policies, which goes through the governance team. So they keep a record of all the policies and what the date for when they're up for review. That gets reported to the executive leadership team every quarter. And that's also sent out to the managers. So, for instance, we've just gone through and reviewed that and given priority to a number of policies which are out of date. Part of it too is I think we're also having a look at the time frame for reviews, because there are some policies which are low risk and we could extend out the review date for those. So we have a process for that. Just in relation to...
Thank you, Wayne.
Yep.
Could that, once that exercise has been done, could that come forward to the Audit and Risk Committee for review, please, with respect to the list of policies and the timelines associated with their review as a governance oversight, please? Yep,
certainly we can do that. And just in relation to your comment regarding best practice with the Aquatic, I think the Aquatic is at that in a number of areas, and the reason why I say that is because recently they've won a number of awards in terms of their operations of programs and activities. But absolutely there's some back of house stuff, things which we just need to sort of tidy up.
Thank you, Chair. Thank you, Wayne.
Ben, you've got your hand up.
Yes, thank you. Through the Chair, just had a couple of quick queries. The first one, just on page 8, it gives us a summary of the rolling strategic internal audit plan over the last number of years. Just noting for 2023-24, there's 3 audits which are not started or completed, I suppose, last year, which is quite a big percentage of the actual annual audit plan. So my question is, what's the current status of those audits which are completed? And will those audits be considered as part of the 24-25 areas of review?
Through you, Your Worship. Looking at the internal audit plan currently, the bottom, so city strategy, customer service, information technology, they weren't allocated hours. They were essentially listed as something that the city could look at reviewing in the future if we were looking at additional areas to undertake auditing of. In terms of the areas that were scheduled to be audited, just looking at it briefly now, I believe they're all completed except for the disaster recovery. And the reason we didn't focus on that this round of audits was because we only just did a major overhaul of our disaster recovery documents. Essentially where we're at this point in time is, given we're seriously looking at progressing shared services with Coburn, who have their own internal audit plan which needs developing, we're essentially looking at putting a hold on developing our renewed internal audit plan until we could work out where we were going to fit in with their internal audit plan drafting. If that's going to take some time, as I mentioned, we will engage Australian auditors to do some ad hoc auditing services, and we're looking at what key risk areas they can review for consideration by the committee at upcoming meetings at this point in time. But to answer your question, I believe that the majority of areas in here that have hours identified for auditing have been completed, except for one. And once we know where we stand with shared services with Coburn, we'll start progressing seriously the drafting of a new internal audit plan for the future.
Okay, thanks. And through the chair, I think if I'm reading this table correctly, I think there's 3 that are not started that have hours against, which is environment, health and services waste, the project program management, and the business continuity plan within the last 2 years. And yeah, recognising that the last number are not started and may not have had allocated hours. So yeah, if I'm reading that correct, I think there is sort of 3 that are not sort of started as part of the 3-year plan. And maybe through the chair, I guess a typical internal audit planning process would commence before the start of the period. We're 3 or 4 months in now, and we don't have a 24-25 plan, recognising that there's elements we're still working in terms of acquisition of resources, aligning plans, etc. But I do feel it's something that is a core element of an audit and sort of risk plan and committee's remit. So maybe sort of through the chair, perhaps a specific paper or reference as part of the next audit and risk committee report is to look at the 24-25 plan with the information that we have in terms of resources, just to make sure that it's meeting the committee's purpose, it's covering off strategic risks, etc.
Through you, Mr. Mayor. Just a couple of comments in regards to that, Ben. The difficulty we have is that a number of the areas are also covered off by the external auditors. So, for instance, the business continuity one, if you recall, was done quite extensively in the last audit, which was then picked up, and then that became an action item. So the comment Russell referred to, so we've done a lot of work around the business continuity plan, which is why that's one we haven't got started, but in a way that's actually been completed because it was picked up previously. But definitely take your point. We've been working quite a bit with Coburn to try and get this resolved. And then the idea is to really try and bring our 2 audit plans together so that we can get some synergies and efficiencies in terms of how these audits are conducted. But the idea is to get that resolved before the next audit committee meeting.
Great, thank you. I had a similar question to Gay around the aquatic centre. I think the key driver is really around the risks around the aquatic centre itself, given that's a safety audit. So to remove that and focus on functions, for me, doesn't seem like it covers off the risk or the driver. But I think that question is on notice. So yeah, happy to receive that information when it's due. One element across the reports is the risk matrix as part of all the internal audit reports isn't the Kwinana risk matrix. It may be from the service provider. It's in terms of best practice, we should be using our own risk matrix, for which then the findings are relevant to us as an organisation, as opposed to an arbitrary risk criteria. So maybe through the chair's suggestion is for future audits is to make sure that we use our City of Kwinana risk matrix. I had one query just seeking comment on, so this is on page 32 and relates to the essential services internal audit. There's a comment in the 5th paragraph that due to the process of transition, the authority that we're excluding, well, limited review of pet registration. But again, that seems to be a key part of why the reason the audit was on in the first place. So appreciate there's sort of changes, but similar to the aquatic one, to start sort of quite severely limiting, sort of scope areas, perhaps doesn't meet the intent for which it was put on in the first place. So I suppose my specific query is, why did the review occur, given that it was quite limited in terms of scope?
Through your worship, I agree it was quite limited in scope, and that was purposeful at the time of engaging Australian auditors. Obviously, essential services and even particularly the rangers deal with a wide raft of issues here at the city. I mean, if we wanted to, this audit could have been a very expensive, time-consuming exercise for the city. For that reason, we engaged with the team to look at some key risks that they faced, and we really asked Australian auditors to focus on those risks. So it was narrowed in focus intentionally.
Okay. I suppose to comment based on that, there's two audits, there's both of which are limited scope and preset at the end of the year. It's just been mindful when we have a strategic plan which we are executing, and the two elements of scope limitation relate to some of the drivers for those. So, if we're starting to evaluate that we may need to revisit the internal audit plan, then having a bit of a robust process just to make sure that those scopes aren't arbitrarily reduced, and maybe take an opportunity to revisit the plan in itself, because it appears just from reading from the outside that these audits were completed at the end of the year, which is good to meet the plan, but sometimes the intent's missed by just executing the audit. For instance, we're calling it a pet registration audit, but very limited work was done in that. So going forward, we think we have a sense of assurance over those, but in fact, we didn't do much work in it because of the nature of the transition. So I suppose it's just a comment rather than seeking a response, but that should form part of the planning process, and making sure that when we're completing and scheduling audits, they're done in sufficient time to allow the scope to occur as designed.
Through you, Mr. Mayor, the main one, being in relation to this, as Russell's pointed out, is the reason why we do the scope is to focus on what we perceive as being sort of the key risks in those areas at this point in time. And then to try and also align with some of the stuff that was picked up in the previous external audits. But one of the big factors is the funding that we have to extend the scope out. Each of these audits are about $7,000 per one. So we've only got a limited budget. If I can get further funding from council, then we can extend the scope out, because as you know, it's a time cost factor. So we're really trying to narrow down as to where we see where the risks are, and then we can do other scopes in future audit plans.
Great, thank you. And I think that's a key part of the annual planning process going forward. I think what you've described in terms of trying to co-share with City of Coburn, for example, is a good initiative in terms of efficiency and getting bang for your buck. And I think the hours allocated to those audits are sort of quite tight to execute the scope. So, being mindful of scope creep, etc., I think is important. And I think, as part of that annual planning process, just making sure we're covering off the key risks is something which was a driver for the current 3-year plan, and hopefully for the upcoming plans also. I had one question around ASAP within the action due dates, which I think you've already sort of covered off. So essentially having due dates rather than commentary around ASAP. But I think that's been covered. I had one question around the interim IT general controls audit. So this is on page 46 of the papers. Also, of the audits, given that it's from the OAG, it's one of the higher order internal audits. And on that, just noting that there's 2 prior year findings in relation to network and remote access management, as well as user access reviews. So those are 2 moderate ratings. So I just wanted to get any sort of additional context on why these repeat audit findings.
Through the chair, the issue we've had in the past with the OAG audit is we received the audit in December, so it's presented to the Audit and Risk Committee in December, and they restart their audit in March. To get a clear audit, we have to have the control in place for the entire financial year. So even if we do it the very next day after receiving the previous audit, because the next audit starts in March, we still have a finding. So every time we have a finding, if we don't clear it immediately after we receive it, providing we receive it before the end of financial year, then we'll have it in the following audit. So all three of these have been cleared. We managed to speed up the audit this year and get it done before the end of financial year, so none of these findings will be continued into the new financial year. But the two that you raised were, one of them was a finding from the previous financial year that we fixed in the previous financial year. The other one was a finding that was picked up in the previous financial year, was fixed to the satisfaction of the auditor in that financial year, and they're happy not to repeat it, but because we decided to enhance our control, they thought it would be reasonable to just flag that we've now re-reviewed that risk and enhanced the control.
Okay, thank you. Final question from me, and it relates to an item on page 113, the incident reporting processes and procedures. So Appendix C, sample test results, and I don't want to get into the detail, but one sort of element for incident reporting that jumped out to me was of the sort of sample of 11, which is a reasonable sample. Only one of the incidents reviewed had corrective actions identified by management as part of the process, which I thought was a sort of interesting element, because that's generally quite a core part of analysis. So I just was seeking sort of any maybe feedback or additional sort of context on whether this might be an anomaly versus part of standard practice for when we do have incidents. There is further review, because I think through the Audit and Risk Committee, we generally get some information around the level of work that's done to understand the incidents. So I was surprised to see this. So I just wanted to ask this sort of question around management's view of that particular finding.
Through the chair, the audit findings raised some interesting discoveries in the MyOsh system, and it was identified that the system was being used incorrectly, whereby the corrective actions in the systems should have actually been recorded in the action section. So the audit flagged that the system was the data was being input into the system incorrectly. So we've now worked with the software provider. We now know that the corrective actions need to be put into to a different field in the system. Each and every incident since MyOsh has, we've gone live with MyOsh. We've gone back. I have a workplace university student working in the work health and safety space, and he has gone back and he has put all of the corrective actions into the correct field. So the information is now in the system. In addition to that, one of the findings was that some of the incidents were not being closed out on time. We've had a program of going out to all of the supervisors who use the system. We've been upskilling them in the system. We've been asking them to put more information under the actions, so the corrective actions. So there has been a huge amount of work done in this space, but it was certainly highlighted through the audit.
Ben, sorry, you've jumped to item 8.3, so if we could just go back to 8.1. Would you have anything else for 8.1?
Sorry about that. Oh, so that was all for an upcoming one in the incident reporting. I'm just getting excited over here, so apologies for that.
Okay. Sorry, Gay, you've got your hand up as well?
I'll remove that from my future questions. I thought I'd get them in early. But,
okay.
Yeah, that's all good. Thank you.
No worries.
It's like we're dueling to get our questions in, Ben. My question relates to the training of the parking officers. Again, this is only low, but it does say there's currently no structured, formalised and documented training plan for the parking officers. What I'm interested in understanding is, does that mean that there is no training or just lack of transparency? And it also raises a question for me as to whether we have transparent training for all our frontline employees. Thank you.
Through you, Chair, in the absence of the Director, I'll provide a brief response on that matter. My understanding of the audit finding in relation to the training of parking infringements was that although rangers get extensive training and they're required to undergo certification for their positions, it's actually a very tricky position to get, I understand. There was no training that we undertake specifically to deal with that very niche part of their role. So it was identified that although they received training, we need some documented processes around the parking infringement side of their role.
And across the rest of the organisation, are there formal training plans in place, especially for client-facing activities?
Through the chair, yes, there is. It's an approach that is not just one-pronged. I guess that it starts with the recruitment process, and the position description will have a set of criteria of the qualifications and the experience that the incumbent coming into the position is required to have. Also, through their first day on their induction, it is identified what areas that they may or may not have in terms of training or a skill set, and if it is identified at that point, then we will look to put that person through the training. It's also identified through the probation period, whereby in the first week the employee sits down with their supervisor and they go through a whole gamut of what skills they do have and don't have, and then at that point then the manager or the supervisor can also request training in that area. Specifically across the organisation, we will have internal training, which is often compliance training, in terms of we will bring in a facilitator to undertake this training for staff, and it could be, for example, any of our forward-facing staff who need to deal with difficult customer. We would have a provider come in and talk about challenging situations and training in challenging situations, what to do, what not to do, and so forth. In addition to that, we have the staff development annual review, whereby the supervisor and the employees sit down. They look at all the training that has happened throughout the year. They identify where if there are some gaps and the priorities of those, and all that information is fed into a document, which then goes back through to the HR development team, and we do a training needs analysis on that document, on those outcomes. And if across the organisation, for example, there is 15 people identified wanting the same sort of training, we will look to bring that training in-house because it is more cost effective. If it is one person, then we will seek to find a provider outside the organisation, and there is a process for applying for that training, and the employee will be sent on that training. That's it in a very nutshell.
Mr. CEO.
Through Mr. Mayor, just a bit of context, Gay, around parking. So unlike other cities such as Fremantle, Perth, parking's not a big part of the work which the rangers do. So we don't have separate parking officers. So it's a duty which the rangers undertake. The main parking area within the city at the marketplace is a private parking. So they manage it themselves. So really the parking, not to underplay what they do, is managing parking around residential areas. So absolutely we need to focus on that area, but it's not the major part of their work. Their major part is around animal control.
Okay. And just one final question through the chair. I note the intent of having a strategic partnership with the City of Coburn, and in the interim, we're using Australian auditors. Can I please just put a question on notice to make sure that we have a sort of an appropriate procurement and contract with the Australian auditors, because this is going on for a period of time, and we would want to make sure that we're complying with tenders and contracts that are in place. Thank you.
Any other questions? Councillor Sargent?
Thank you, Mayor Feasy. Through the chair, I just want to ask regarding page 25 of the agenda. It brings up around that there is no documented policy to exclude sick children in the creche handbook. That's got me thinking on the back of Gay's question with the broader facing City of Kwinana, public facing, I guess, community, like our libraries and the Aquatic or other areas. Do we have any specific policy regarding about illness or infectious controls about not attending a space, or members or users being aware when they join up as a membership to go that this is for community safety, not okay? I guess on the back of COVID, I'm assuming that there potentially would be something like this going forwards, or do we have this?
Through you, Your Worship. The aquatic and the creche areas, when a new parent comes in, they do go through an induction process, talk about children's illness, making sure they're not coming in for while they're sick. It's definitely, I would say it's exclusive to children. For the aquatic, there is information about using the facilities and not entering the facilities. The big thing is it's not formalised for this part of the report, but with other areas, we do need to rely on people, particularly in public facing, say the library. We do need to rely to a point on people using their health as their goodwill and not coming into the facility. If we have a program in different locations and someone is sick, we would ask them if they could leave or have a conversation with them respectfully about their illness.
Another question?
Thank you. More, can I make a comment or action as some policy that I've seen working in community and the particular community organisation I work into? We've also done a sort of a public notice. It's not so much offensive per se, but it's just an education poster that's on a wall saying, you know, please, if you are infectious, that to not enter because of the risk of others. I'm also just thinking things like the gym. There are people that maybe have autoimmune and things like that, or are using the hydro pool because they're recovering from a surgery. And the last thing we would like to have happen is someone in our community, and I guess I'm more thinking the rec, as there's a lot of transmutable places there in that particular space, but it might be an action to look into that could potentially just bring that community awareness going forwards. Thank you.
Through your worship, a couple of the big things with the rec are, well, there's definitely signage around facilities around basic health and sanitisation. Don't come into the facility if you are unwell. Rec, definitely, particularly in the gym space, there are requirements to wipe down equipment after each use. We do provide sanitised hand towels so people can wipe equipment down, and the gym staff do remind members of that as part of the induction. But I'll absolutely take the point on and go back to the team to make sure adequate signage is up as well around the hygiene standards.
Okay, we have an officer's recommendation that the Audit and Risk Committee note and provide comment where appropriate the findings of the following audit reports as noted in the agenda. Could we have someone move that way? Moved, Councillor Sargent. Seconded, Councillor Acker. All those in favour?
Yes.
Against? Carried. Item 8.2. Audit action log progress report. Is there any additional information to start with?
Through the chair, just very briefly, you'll note from the first page of the attachment, the audit log now includes the actions arising from the 4 recently completed audits, of which the interim IT general controls audit, the 3 actions have been marked as completed. The second page lists all outstanding actions from previous audits, of which there's 5. One of those is marked ready for completion. The others, whilst overdue, one of them is going to be ready for completion after this meeting. The remaining 3 will soon be ready for completion and are still ongoing.
Questions? Start with you, Gay.
No, thank you, Chair.
Ben?
Just a sort of comment. The summary works really well, I think, in terms of giving that overview, and something to look for is any high risk-related items or sort of any overdue items. To, there's a large amount of resources that goes in internally to managing these, and obviously it's shown a positive trend. So yeah, a lot of hard work to get to this stage, and having that oversight as well is useful. So just a comment rather than a question, but yeah, that was it from me.
Okay, thank you. Any other questions? Councillor Sargent?
Thank you. Sorry, I was expecting them to ask questions so I could find my page. On page 65, and that was the only other thing when you were talking about the evacuation, if there was an incident at the Aquatic. I just put down a note. Could you please clarify what the current evacuation procedure is? Obviously, with minus the counting software that has been, I assume we have a risk mitigation progress in place. If you could talk to that, please.
Through you, Your Worship. Yeah, absolutely. There's a very thorough evacuation process for a place like that, and different evacuation requirements depending on the incident. For example, a full centre evacuation. There might be a part centre evacuation as well, where if, say, there was a member of public incident, we move people in the facility to a safer area as well. So the staff go through and contractors go through very detailed training around the evacuations. We do a number of drills at the facility, both desktop and physical drills as well, using the different evacuation points. So it's an extremely structured model within a rec centre for and training for staff as well on how to evacuate. Really designed to be the minimal number of staff in the facility as well, because Murphy's Law, you can guarantee that if something was to happen, it would be at the quietest times when we've got the lowest staff numbers. So we do that from the low numbers of staff right through to a full facility.
Thank you. That's fantastic that you've put that much thought and thinking of the lowest number to be able to achieve the result.
Okay, we have an officer's recommendation that the Audit and Risk Committee note the status of the outstanding audit actions as detailed in the City of Kwinana's audit log at attachment A. Can someone move that? Moved Councillor Acker, seconded Gay. This is McMath. Put it to the vote. All in favour?
Yes.
Yes.
Against? Carried. Item 8.3. Did you want to ask your questions again, Ben, or are we happy with the original answer?
Happy with the original answer. I just had another couple of ones in relation to this agenda item.
Yep, if you want to ask away.
Thank you. One question was, appreciate the update in terms of the enhanced reporting in terms of statistical data. Just a query, do we have a likely time frame for MyOsh to be able to provide that information?
again, the answer to this question is two-pronged. We have sent a team of 5 of our staff to the city, to other local governments that are using a more mature MyOsh system, and looking at their lots of different aspects of the system. Some of those aspects have come out of the audit, such as workflows, timeframes on the workflows, certainly the corrective actions, all those sorts of things that are recommendations from the audit. So, and different parts of the organisation are looking at using MyOsh in a different way. So the team went to the local governments and have now got some more information about what can be done. We are progressing that some of those amendments with the work placement student, who is working very closely with MyOsh and being able to, the back end of the system needs to be changed, and is working in that space. There's not a definitive time frame. However, progression has been very, very quick, and some of the enhanced data will most likely be seen in the beginning of early next year. So the graphs and so forth should be early next year.
Okay, thanks for the update. Appreciate that that's been worked on. I think initial request was in February this year, so for nearly a year to turn around some additional graphs, it sounds like a significant amount of work there. So hopefully that's something that's not causing too much internal sort of effort, because I don't believe our requests would generally be too much out of the ordinary. So slightly concerning that the amount of work and time to get to some basic data reporting function, but look forward to the update in January next year. The follow-up sort of query was just noting that there's been 23 incidents over the 3-month period. 10 of those are injuries, and one of those was a high rating. And just wanted to get some additional sort of feedback around particularly that sort of high one, and how it's sort of how it maybe a high level sort of summary of the incident, but also was there any sort of themes coming out of the last sort of quarters that particularly relate to some of the key risks that we have at Kwinana?
Through the chair, the high rated incident that you've identified is in relation to 2 members of the public, potentially homeless members of the public, who have at previous times been outside of our facilities. These 2 members of the public have a relationship of some sort, and this relationship kicked off early one morning, and one of the members of the public threw some bleach at the other member of the public, and at that time our rangers were asked to come to the facility to try and see if they could move on the 2 homeless people. And they did so. The homeless people apparently have reconciled, but that was rated high due to the use of the bleach in the situation. In terms of some of the incidents, I guess the trending that we're seeing is more around their report. We are seeing more reports that we're getting as staff to report in relation to psychosocial hazards, in terms of verbal abuse, threatening abuse from members of the public to our front-facing staff. And so it is around their psychological well-being. And so I would say that is the trend that we're seeing. We're just about to kick off the next, this month in October, the next lot of training for our front house staff called Am I Safe? And the premise of this course, it's run by an ex-policeman about making sure that you don't put yourself in danger, and ways to, I guess, de-escalate without putting yourself at harm. And so we are seeing those reported because we want to make sure that our frontline staff, and all of our staff for that matter, are safe, and that whilst one incident might not have an impact, if there are many incidents and they could build up, and we just want to make sure that all of our staff, we are following up and making sure we have that duty of care for our staff, making sure that the situations are debriefed. We're making sure that they've got access to our EAP. We're also making sure that we're following up with our staff on regular basis once an incident has occurred.
Great. Thank you for the context. I think that psychosocial has been organisational priority that's been discussed over many audit risk committees. Are you receiving that feedback around incidents? I think it's a positive thing. I think generally incidents there's a learning from it, or the encouraging people to speak up. I think it's a really positive thing. So there's some good learnings from that, and typically you expect that to even out over time. But certainly in terms of the awareness and people understanding it's a risk and has consequence, yes, certainly that's some valuable learnings from those. I think sort of final sort of comment and sort of suggestion is for particularly that high rated incident. If it's sort of correctly rated as high rated and that's gone through the work health and safety sort of committee, then making sure that there's the appropriate reference within the risk register is quite a good step, is just to make sure that we've adequately covered that as a risk, or potentially control, depending on how we've covered certain risk elements. I think if we're saying it's a high rated issue and it's fundamentally sort of high, then we should see quite a strong reference within the risk register. So maybe through the chair, it's just to encourage for any of those high rated issues in the future is just to take a risk lens and just make sure that we have our risk register appropriately considering those elements. So and thanks for the additional comments, and no further comments from me.
Mr. CEO.
Through you, Mr. Mayor. Ben, just in relation to categorisation of risks, so Russell has been working with a provider, Risk West. So we've done a lot of training with people who are responsible for risk management reporting and that around how they identify the risks, how they categorise the risks. I think at times there's a tendency to over-categorise some risk. I'm not saying that this one is an example. So we should start to see some changes in that. The training has been extremely well received. And in fact, so this is sort of, I'm doing a bit like you, I'm jumping to 8.4. But what we're also going to be undertaking, for instance, is a full review with Risk West around our strategic risks. So I think you'll start to see a lot more clarity around how the risks are identified and then how they flow through to other documents.
Great, thank you.
Was there any further questions, Ben?
No further questions.
Gay, you had some questions?
Thank you. Look, I'm on page 106, and it's a general comment with respect to, again, our policies being out of date. So I note the response previously and that it will come forward to the committee, but I think it's really important if we don't have policies updated, especially around work health and safety, then we have a greater risk to the city and to the community. Could I also make a comment that when the auditors write the documents may not reflect current practices, my preference is they say they do or they don't, as opposed to may not. And then we can categorise that rather than being low as appropriately higher, especially again around workplace health and safety. So it's really around having an understanding with the auditors as to the clarity we wish with respect to their implications and recommendation. Thank you.
Through you, Mr. Mayor. Thanks for that, Gay. Yeah, I'm picking up your point and looking at it. So we'll have a discussion with the auditors around how they structure and the language within the report.
Any other questions?
Thank you.
Councillor Sargent.
Thank you, Mayor Threesy. Through the chair, I'm on page 87, and it was more just a question regarding item 1.3, the hazard management principles. You've said that in the comments that you have now included Wellard West tender documentation as the first contract to have this criteria. Can I just ask how that was received and if the city has found this to work effectively?
Through the chair, this is not the first contract that has been included in. This is our auditing of it being included and being effectively used. So the requirements have been in legislation for quite a few years. A couple of years ago, when we implemented a strategic approach to improving our workplace safety, we included ensuring these were in the construction contracts as part of future contracts. So we went through, we ticked it off, that was there, and now this is to make sure they are there. Builders have been doing this for a long time, so they expect it, but for us it's making sure that it's effective and it's being used properly, and it's not just a form approach to it, but a nuanced approach.
Did you find it was successful?
Through the chair, that contract hasn't been awarded yet.
Any other questions? Councillor Sargent.
Thank you, Mayor Feasy. Through the chair, not so much a question as I think a statement with regards to when Ben was asking about the incidents. I just want to highly recommend how fantastic it is to see the safety culture of the city of Kwinana. I am aware with the cost of living crisis that's going on, your forward-facing staff, as I see in my work day, there is a large uptake of intensive crisis, people in very poor mental, physical health situations that are walking into the doors, and the fact that the City of Kwinana staff feel confident enough to actually make these reports, as well as knowing that the senior management is standing behind them to back them. I'm just really proud to hear that this has come out of this meeting today. Thank you.
Any other questions? A recommendation that the Audit and Risk Committee, 1, note and provide comment where appropriate on the City of Kwinana Safety and Wellbeing Strategic Plan 2024-26. Note and provide comment where appropriate on the City of Kwinana's WHS statistical data report. And note and provide comments where appropriate on the internal audit report on incident reporting. Have someone move that way? Moved Councillor Sargent, seconded Councillor Acker. All those in favour?
Yes.
Yes.
Against? Carried. Item 18.4, Risk Management Report. Do you have any additional information, Mr. Mark?
Through the chair, there's been one risk added to the city's risk register since the last meeting in June. That is SR30, and this risk essentially relates to the effect on on business continuity in the event that key city buildings become unavailable, such as the administration building. So that's the only new risk since the last meeting. There's otherwise been no change to risk ratings in the register. As the CEO mentioned, we had Risk West earlier in the month attend the city to provide training to leadership staff. It's hoped that they will, we are planning for them to come back and help increase our risk maturity. I think the training was well received, as the CEO mentioned, and was very useful across the organisation. So we're hoping to get the benefit of their knowledge to increase our risk maturity going forward.
Any questions? No questions? Ben?
So just one question. Just on page 124, which gives the risk summary. It gives us a description of the risks, residual risk rating target, and then it's got a trend column, which is there's always been, I believe, empty. Is that something that's utilised? Because, as an example, we talked around the new risk, SR30 being added on this period, but the trend is still blank. Is that something that, there's a field for that, or because if it's not, then whether or not we sort of remove that, or whether it's a reporting element behind the scenes. Just wanted to sort of check whether a trend is sort of utilised as part of the system capture.
Through the chair, the trend has been there on previous occasions. It appears to just be a back end issue on this occasion. For whatever reason, one of the settings wasn't selected, but that information is available, and I'll make sure it's presented at the next meeting.
Great, thank you. And no further questions.
So we have an officer's recommendation that the Audit and Risk Committee note and provide comment where appropriate on the City of Kwinana Organisational Risk Register, Strategic Risk detail in Attachment A. Someone move that way. Moved Councillor Sargent. Seconded Councillor Acker. Put it to the vote. All in favour?
Yes.
Yes.
Against? Carried. The final item is item 8.5, the investment policy. I believe there was an amendment. Did everyone receive the amendment?
I'll just provide an overview.
Could we be just taken through that for the record, please?
Yeah, the CEO will just run through the amendment.
Through you, Mr. Mayor. Thanks, committee. So this has obviously come back to you following a review. Unfortunately, Venetia couldn't be here tonight because she had a family death and had to travel away. So what we've done in terms of the review, we've looked at other councils and how they've done their ones. We looked at the S&P rating-based limits. And so what we've done based upon the feedback that you provided is we've included a maximum percentage of the total portfolio that could be invested. So once again, this comes back to the level of risk as advised by S&P ratings. So as an example, government guaranteed deposits, you can have 100% of your total portfolio in there. The amendment which we sent out, and I think it was because of a track change issue, it didn't get picked up. Bendigo Bank being one of the main ones. So based on your feedback, we've taken that back down to what the maximum percentage with any one institution was previously. So that's back to 45, not the 60%. And the maximum percentage of the total portfolio shouldn't be 100%, it should be 45% as well in relation to that. I think one of the things to bear in mind in terms of these percentages, we're not going to put up to that level because it all depends upon the interest rate which we can obtain through any one of these institutes. At the moment, Bendigo, they're okay, but they're not up there with some of the other AAA or government guaranteed deposits in terms of the interests revenue that we can receive. So that's sort of the main change to the policy. We now have a maximum percentage of the portfolio. Bendigo Bank's gone back and it's got a percentage in terms of the total portfolio.
Questions, Ben?
No questions from me.
Gay?
Thank you, Chair. Yes, thank you very much for reviewing this. I think it is now a sensible and not conservative, but appropriately risk-balanced exposure. So I'm happy to support it. Thank you for the work.
Any other questions? No, then we have an officer's recommendation that in accordance with the Local Government Act 95, an Audit and Risk Committee note and provide comment on the amended City of Kwinana investment policy as detailed in Attachment A. Amended Attachment A. Someone move that way? Moved Councillor Sargent, seconded Mrs. McMath. Put it to the vote. All in favour?
Yes.
Yes.
Against? Carried. I don't believe there is any late or urgent business. There are no answers to questions which were taken on notice, so I'll declare the meeting closed at 6:35. Thank you for attending.
Thank you, Chair.
Thank you.
Thank you.
Goodbye, everyone.
Enjoy your holiday. And she's gone.